So welcome formally to the launch of the Health Translation SA MRFF grant scheme. I'm very pleased to be acknowledging that we have the Hospital Research Foundation Group and the Women's and Children's Hospital Foundation. Both are funding partners in this scheme, and without them, we would not be doing it. So I just wanted to really acknowledge and thank the two organisations for committing to be part of this inaugural, or the start of a scheme that we hope will go for many years in the future. But they have contributed, and I'll talk about the amounts as we go through the presentation. But as I said, without them, it wouldn't be happening. So thank you to those guys, and I think they'll be online at the moment. And they've also been part of helping us design it. So I think it's been a great partnership to date, and hopefully it'll just be a launching pad for continued support for the South Australian environment, research environment in the future. I'd also like to introduce myself formally, Wendy Keech. I'm the CEO of Health Translation SA, and I will talk a little bit more about what Health Translation SA. I've been in this role for some time, and I think this grant scheme actually captures a whole lot of things that we've been trying to do for a few years now. So hopefully you'll see as the construct of this scheme pulls together a lot about what Health Translation SA is trying to do across the state. As I mentioned, the session is being recorded, and we will have the information available. So let me just move on to acknowledge that we're meeting on the lands of the Kaurna people. That's me here at, I'm based at Samri today. And I'd like to acknowledge the Kaurna people as the traditional custodians of the Adelaide region, and recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. I would also like to honour and pay respect for Kaurna elders, both past and present, and for all generations of Kaurna people now and into the future, and acknowledge the work that we do with Aboriginal people and Torres Strait Islander people across South Australia and nationally, and just acknowledge the importance of the work that we can do as translation centres in getting the evidence into practice to improve the health of our First Nations people. I also wanted to just mention the importance of the voice and the referendum that will be later in the year, and for all of you on this call to make sure you are as well informed as possible, because it's a vitally important construct for Aboriginal people across Australia moving forward. So with those preliminary words, I'd like to tell you a little bit about Health Translation SA. We are an NHMRC accredited Advanced Health Research Translation Centre. We have 11 committed and active partners, and you can see their logos at the bottom of the slide there. We are based and administered by SAMRI, and we have strong relationships with all the other partners as well. That includes SA Health and all the LHNs, Flinders University, Adelaide University and UniSA, and Torrens University, CSIRO, the Aboriginal Health Council, the two primary health networks, and the Commission on Excellence and Innovation in Health. Together, we are looking to accelerate research findings into healthcare practice and policy, and increase whole of system research translation capacity, with the aim of improving the health of all South Australians. I know it's a lofty purpose, but that's what gets us out of bed. And I've got a great team that work with the partners, and without the partners, we wouldn't have the reach that we need to really work across South Australia. Importantly, there are 14 translation centres that have been accredited across Australia, and we work closely with all of them through a mechanism called ARA, the Australian Health Research Alliance. And it is that mechanism that allows us to actually reach in and to the NHMRC and the MRFF and a whole lot of organisations at a national level. And this is a very powerful position that we're able to contribute to, that we want to really drive the agenda of translating evidence into practice and really bridging the gap between health services and research across the country. And we do that with commitment and with the drive to really improve the benefits for everybody. So the way we work is to work as an independent catalyst and broker. We try to unite a range of activities across the state, from policy, education, training, health services, researchers, stakeholders, and of course, making sure the consumer and community voice is at the table at all times. So our work is really around being that catalyst and broker and being able to bring people together to really address major health system and service challenges. It's not, as I said, it's not a small task. So it is with a lot of effort that goes into trying to build these collaborations and relationships. So what I'm here today to talk about is the Catalyst Grant Scheme itself. It is a new scheme and we're really pleased to be working on it and launching it today. It will be rolled out across South Australia over the next 12 to 18 months. And it really is being designed to build health service, to be health service led and to build collaborative research projects. It's been designed by us at Health Translation SA, but with a very collaborative and helpful advisory group that's been chaired by Dr. Liana Reid, who's HTSA's independent chair. And it's also included the funders, a range of experts from across both the MRFF and the research sector and the health services and sector, and also consumers are on the advisory group, and they've helped us design this scheme. As I mentioned earlier, we wouldn't be doing it without the funding from the Hospital Research Foundation, and in the first year that's to the tune of $240,000. And the Women's and Children's Hospital Foundation, which is to the tune of $120,000. So what is it? And today I really want to give you the the bones of what it's about, and I guess the philosophical position about what's going on here. And as I said, the guidelines will be released on Friday when you can actually get into more of the detail, but there is an opportunity today for you to ask questions. So as you go, if there are questions you want to put in the chat, we will try and synthesize those and give you responses. And we also will be doing up a Q&A for the scheme. So what is it about? It's to provide targeted funding to develop or refine research projects that address a priority unmet health or healthcare need that is of importance to health services in South Australia. It will need to pass a health desirability check, meaning that health services will actually check to see whether this is a priority to them. And the teams that are putting in applications are going to have to consider their alignment to health service strategy, and also making sure that it is a priority activity for the health services and provide evidence to that tune. Importantly, this scheme is about aligning to the MRFF principles and priorities, hence the name. It's the HTSA MRFF Catalyst Scheme, and it's about aligning with the MRFF principles and priorities. So with the goal of submitting an application to the MRFF within 12 months of the project completion. Now, this is a really important takeaway for everyone today, that if you don't think that that's something that you would be thinking about, don't apply, because that's how we're going to be measured. So what I want you to be thinking about is how you do that. And as we go through it, we'll unpack those principles and priorities of the MRFF. It also is about building across institutional collaborations across South Australia and potentially nationally. And we are mandating, as part of the project team, is that teams will have members from at least 2 health service organisations and at least 2 academic research organisations or health and medical research institutes. So in the core team, you need to be representing at least 2 health services and at least 2 academic research organisations. You also need to involve end users, consumers and clinicians, and support and ensure that your team is supporting diversity. The project also needs to think about the scheme is supporting SA leadership with a vision to have impact and scale up. So it's how you position. We want South Australians to be standing up and leading these projects, and we want them to be thinking about how they have impact and scale up. Maybe not within this initial project, but the vision to have impact and scale up. Now, we don't have a huge amount of money, but we think it's a good starting point. And we will be awarding grants between $20,000 and $60,000 per project. And projects will need to be completed within 12 months. So really what we're trying to do with this scheme is build a pipeline of research projects that are MRFF ready. Now, we can't say exactly what's going to happen with the MRFF, but we have got pretty good guidance and signposts now around what's going to happen in the next 10 years in the MRFF. So by reading between the lines and by really looking at the previous MRFF rounds and future MRFF rounds that are predicted, we think we'll be able to have projects that are going to fit that brief. Why is it needed in South Australia? Because we really believe that we need to build this pipeline of collaborative projects for both the MRFF and other grant schemes, and that there are big opportunities in South Australia to build this pipeline. We know that we need to improve the rates of translation of research into practice by connecting researchers with health services, and we need to know that we are focusing around health service priorities. We wanted to have a scheme that is not siloed or focused on an individual institution. We know that there are great grant schemes already, especially seed grant schemes, both within health services and within academic institutions that fund within those institutions. We wanted to have something that went across. We know from the SAPC report that there is a need to retain our EMCRs in South Australia, and we think building that in as an element of this scheme is important. We know from our flagships, and Health Translation SA has 6 flagship programs that are operational across South Australia. We know that they think this sort of support is critical to actually get them to be MRFF ready. And we also believe strongly, and the Health Translation SA board believes, that South Australia needs to collaborate and compete nationally, and not just compete within the state. Obviously, there are things that we need to do within the state, but we really want to think about how we can collaborate within the state and nationally, and then be competitive at a national level. Also, why the MRFF is important. The MRFF is increasingly important as part of the health and medical research funding in South Australia, and that part of that landscape. It's now reached, you'll be familiar with this, I'm sure, $20 billion, enabling projected disbursements of $650 million per year. And the budget last night reinforced that this will continue to happen over the next few years. And we know that individual researchers, teams and institutions need to orient around MRFF identified areas of national priority and meet the demands of the MRFF if they are going to achieve success. So we really believe getting people to think deeply about the MRFF will provide that opportunity to do this. And the final why point, and again, many of you will be aware of this, that building research-rich health environments are better for patients and staff. We know from the international evidence that was recently published through the Australian Academy of Health and Medical Sciences that research-rich health environments provide high quality care, they reduce mortality, they improve patient experience, they increase staff satisfaction, and they're more efficient uptakes of new innovations. So I encourage you, if you haven't seen the Academy report that's just mentioned at the bottom of the slide there, to have a look at it, because the evidence is compelling that building research into health services is a critical feature of what a health service needs to look like moving forward. And yes, it is being done to some level across South Australia now and nationally, but the more we can do this, and we believe this scheme is really taking some steps to be able to build research into health services. So now I'd like to go into the nuts and bolts of the scheme. I did mention that you can put questions in chat, so I encourage you to do that, and also that these are taken from the scheme guidelines. The goal, I probably don't need to go over this again because I've sort of mentioned it, but we will be expecting project teams to make every effort, submit an application to the MRFF within 12 months of project completion. The objectives are to look at addressing unmet health and healthcare needs that are affecting the health services in South Australia, and to design projects around that, to foster diverse collaborations across multiple health service organisations and research organisations, and, as I mentioned, build the pipeline for the MRFF. Eligibility criteria that teams need to have an administering institution that is an HTSA partner. This is for a whole lot of practical reasons, as well as obviously it's great for HTSA, but the practical reasons are we need to be able to administer grants to those organisations. A principal lead must be have a salaried position at the administering institution, and that the principal lead can only be on one application. So that's quite usual at the moment. So I'm sure that's not a surprise to anybody. The application includes a maximum of up to 10 team members, of which 5 make up the core project team. And one of those members of the core project team will be designated as the principal lead. So that's important, and I'll go into the core project team in a moment. And if people are going to particularly apply for the Women's and Children's Foundation stream, one of the core project team members, that's any one of those 5 core project team members, must hold a salaried position at a service within the Women's and Children's Hospital Network. This will be, the details will be in the guidelines, but I just wanted to stipulate. Now, if people nominate to be part of the Women's and Children's stream, that's okay. They can also be considered as the broader agenda as well. Project team structure. So as I said, we've got 10 members per team with 5 people making up the core team. As I've mentioned, they have to be from two different health service organisations. Now, the important bit of this is at least one must be in South Australia. So you can have a health service organisation that's in Darwin or in Perth or on the East Coast. And you can also have a research organisation or a medical research institute that is not in South Australia. However, we are saying there must be at least one in South Australia. And as we've said earlier, the principal lead must be in that team. So I guess the nuance of this is we're really looking for that South Australian leadership, but we're not restricting it because we know the MRFF loves things that have national reach. So we're not restricting it to South Australia at all, but we're getting you to think about who are in that core project team. And one consumer, and I'll go into the definition there in a moment. Now, there's no requirement on the remainder of the project team, but we'd encourage you to think about being diverse. Think about EMCRs or people with equivalent experience, and think about how you might include policymakers or people that can actually make a difference in implementation. Anyway, they're, again, happy to talk about that more. That's a lot of what Health Translation SA does on a regular basis, thinking about how we get things to stick, how they become sustainable, how do they become systematic. And this is why we've designed the project team as it is. Definitions, these again will be in the guidelines, but a health service organisation is as stipulated by the Australian Commission on Safety and Quality in Healthcare. And yes, to the people who've asked questions, it does include general practice. We want this not to just be about the SA health system, just the hospital system. We want it to be broader. And if you look at this definition, it actually does reach across things. But it has to be a separately constituted organisation that is responsible for implementing clinical governance, administration and financial management of a service unit or service units. So I'll leave that with you and let your imagination go wild. The next one's around consumer. What constitutes consumer? And we've taken this definition from the NHMRC statement on consumer and community involvement. And it really is about patients or potential patients, carers or people who use health services. So that's pretty broad, and certainly lived experience and other fits into that. But also consumer representatives also fits into the definition we're using. And that's someone who voices consumer perspective or takes part in decision-making processes on behalf of consumers. So this could be organisations, consumer organisations that you might be very familiar with, some of the charity groups and various others. So now moving on to the types of grants, and this got us thinking a lot when we were trying to design what this looks like. And what we've actually come to and settled on for this first round of the grant is that applicants can choose to submit either a refinement project or a new project. And the definition of a refinement project is to strengthen an existing concept that's been previously trialled, or a project that's been previously submitted to the MRFF, but you know there was a bit missing. You know, you hadn't done the consumer engagement properly, or you didn't have a health economics or a piece there, or you thought you needed to do a much better literature review. You kind of skinnied on that bit, you know. So there's parts of it that you knew, or that you were made aware of, that could be done better, and to really lift the bar for the MRFF so you do get over the line and are successful. So that's what we're referring to as a refinement project. Or the new projects, and they are things that are new, or that you might want to pilot, or you might want to scale up something else that's been previously piloted. And there are a few examples that have come to us over the last few months, thinking about how projects can actually be strengthened, so that, again, their MRFF applications are better. As I said earlier, we know there's a lot of money sitting in the MRFF, and the more we can get into South Australia for projects that are South Australian led, the better. Now, obviously, many of you will be familiar with the MRFF, and I know our success rate is definitely improving over the last few months, and certainly the last 12 months. There's been a lot of success. We still can keep working to continue to improve it. So the types of grants are the two we've settled on for this round. There may be other things that you can think that can squeeze in there, and I'd encourage you to look at the guidelines and see how they fit and ask questions. So the assessment process, let's just turn our mind to that a little bit. And again, you know, this is evolving. It will be it will be definitely locked in for this round, but I'm sure we'll provide feedback, we'll get feedback that will tweak it for the next time. But at this stage, this is the review process, that all applications will be reviewed by a review panel, and our HTSA Independent Board Chair, Liana, as I mentioned, is going to be leading that review panel. It'll be comprised with members with experience in health service delivery, consumer engagement, implementation science, and research excellence. The EOI process, or there'll be two parts to the process. There'll be an EOI, and then there'll be a full application. The EOI process will firstly have an administrative and eligibility review that we will undertake within HTSA, just to make sure you've ticked all the boxes, and that we can actually, you know, throw a few out if you haven't done the right things. We will then do the health service desirability check. And there's now a group of the Research Directors Alliance, which are research directors across South Australia, that will help us do that health desirability check. I mentioned this earlier, but really it's going to be demonstrating that there is alignment with the strategic plan of the health service or organisation that you are working with, or that is putting in the application. And also there has to be evidence that this is a priority project, and that not only across the one health service, but across both health services and anyone else, that it's a priority project that they'll put hand on heart and say, this is important to us. And that organisation will back you in, and there has to be evidence of that. So that's really the health service desirability check. Now, we've taken this from a scheme that was actually being done in the Defence Forces, and they've got a defence desirability check. And this has worked really well for that program, and they've found that the connection with the organisation that is, you know, Defence Forces has been very strong. That's made the research very relevant. So we've lifted that from them on their recommendation. There will then be an evaluation by the review panel itself, and we will then, the top ranked EOIs will be then shortlisted, and we will show that to the funders to make sure that, you know, that it's all fitting together. And then those EOI, the shortlisted EOIs will be invited to put in a full application. At this stage, it's a numbers game. We don't know how many there'll be of things. As we said, the first time we're doing it, so we'll work through that process. And the full application, people may be required to present during that process. So here we are, a little decision tree. We've got the eligibility assessment that we will undertake, the health service desirability check, the EOI review, and then invited to submit full application. So hopefully that will all make sense as we roll out the program. Now, moving on to the actual assessment criteria, we have 4 areas that we will be assessing applications on, in addition to the things I've already mentioned. It will be about unmet healthcare or health and healthcare need and co-design, and that'll be 30% weighting. It'll be about diverse collaboration, and that'll be a 20% weighting. It'll be about alignment with the MRFF, and that'll be a 30% weighting, and then feasibility will be a 20% weighting. Now, I wanted to draw to your attention that the first box, the unmet health and healthcare need, and the alignment with the MRFF will be the primary targets of the EOI review. This other two, the collaboration and the feasibility, will be assessed fully in the full application. Now, that doesn't mean you don't have to put them into the EOI, but in terms of weighting, they're the things that really are going to matter for the EOI review. So I know that's a tad confusing, but the feedback we've got from people that have done it is, let's not make the EOI completely onerous. Let's actually prioritize the things that matter and then have the real detail in the full applications. So that could prompt some questions, but that's where we're heading. I'm not going to go through this in detail, but this will all be in the guidelines. We've got a bunch of questions under each of the areas that I've just mentioned, and they really will guide you and guide the reviewers in the way they assess the applications. And these are the ones that will be done at full application in terms of collaboration and thing. But please, I absolutely encourage you to take all of these elements really into your consideration as you're really kicking off this application. So other considerations, I've mentioned some of these, but I will just highlight that projects must commence within about 6 weeks of the formal date of offer. Now, I'll go through the timeline in a moment, but you'll see that, so people have to be ready to do these things. They can't be thinking, oh, I'll just put this off for another year. We really want these to happen in a timely way. And I think the advisory committee was very clear that we want to get this stuff happening sooner rather than later. And so to encourage investment. And the other interesting thing is we had thought about these being 1 to 2 year grants, but the advisory committee went, nah, people got to get themselves organised and get going on these things, and that they are a 12-month period. So the next point is around ethics, and we're saying that ethics must be built into the 12-month duration. So if you're going to need ethics, which I'm sure people will, think about how they build that into the 12-month duration. The principal lead must be ready to respond to all reporting requirements. So if you're going to go in as principal lead, there will be reporting requirements both to the funders and also to HTSA. They won't be onerous, but they will be there, and the principal lead will have to take on those responsibilities. That there will be contracts, obviously, to exchange the money, and HTSA with the partner organisations and SAMRI, because SAMRI is our administering agency, and that's how the contractual arrangements will work. And there also will be publicity and acknowledgement requirements from the funders and from HTSA. So just other things to just keep on your radar. The timeline now looks a little bit, the tail end of the second half of this, I'll say, is probably indicative. But at the moment, this is the timeline we are working with. Last week on May the 5th, we did the announcement, and that was terrific that it prompted a lot of interest, which was great. The launch webinar, here we are today doing that. The EOI will open on Friday. And then from there, it'll be open for about 3.5 weeks, and it will close on Wednesday, the 7th of June. We will then do the health desirability check and the EOI review over the following 2 weeks. And then come start of July, hopefully by July the 5th, we'll have invitations for full applications, and they'll be open for 3.5 weeks. From there, we'll close those and then do the full application review. And then, as I said, the process of notifying and getting people out there. So tail end of it is probably indicative at this stage, but certainly we are very pleased to be getting this happening in the timeline as outlined in the slide, and that we really want to, get these projects up and running as within a reasonable time period. So finally, just to have some take-home messages, that this is different. it is catalyst funding. We're actually trying to seed across health service and across research organisation collaborations. We really, projects must revolve around health service priorities that involve clinicians and consumers. They must align with the MRFF priorities and requirements. They must be HTSA-led with potential to scale and have impact in the future. They must be able to be completed within 12 months, to have a strong implementation and translation focus. And given the time periods, look, it'd be good to extend already established relationships, but that ball's in your court. And I guess we were looking at it yesterday and thought what we're really trying to design in this catalyst scheme is 1 + 1 equals more than 2. Hopefully it leads to a lot more than 2. So with that, I'd like to just thank again our funders, the Hospital Research Foundation Group, the Women's and Children's Hospital Foundation, for their support, not only financially, but in the design and getting this thing off the ground. I'd also like to acknowledge the contributors, the Catalyst advisory groups, that hopefully some of them on the call, but there are probably some that aren't, but people have been extremely generous with their contributions and advice. And I think that just shows that this idea is actually quite, I guess, motivating people to think a little differently. We've also got the South Australian MRFF working group, and those members have also been very helpful, but there have been a string of other people that have been helpers. Let's say people have been reviewing the EOI process and advising us. So any of you out there who've helped, thank you. It's been very generous. I'd also like to acknowledge the Health Translation SA staff team, particularly Nicole, Rebecca and Kalia, who have put in a lot of work over the last few weeks to get this to where it is. So I think with that, I will pause, ask you to put questions into the chat, and then at the end I'll follow up. So over to you, Rebecca, what have you got for me? Does the lead have to be in South Australia? They need, yes, good question. Does the lead have to be in South Australia? They need to be employed by a Health Translation SA partner. So in answer to your question, it is most likely that they are, if they are employed by one of those partners, they are in South Australia. But I think that's the defining thing, that they must be employed by an HTSA partner. So next question. Hopefully I can answer these better. Will a letter of support be required from lead organisations and partners? And my brain's toast?
At the full application stage.
And the answer to that good question is, at the EOI process, no. A letter of support will not be required, but it absolutely will be required at the full application time. So if people who go through to full application, they will be required to provide letters of support. I think this is just a pragmatic approach, just to say that it's something that we are involved a lot with, providing letters of support for applications all across South Australia, and we understand that they do require time and effort and the right people signing the right things and being really committed, and so we want to make sure they are positioned when it really makes it, when it's required. Next question. Oh, it's coming. Please keep them coming. Oh, there's 17 in there now. Crikey. So the next question is, does collaboration between two LHNs that are both within SA Health, is that considered as two health organisations? And the answer is absolutely yes. So two LHNs are seen as two separate health service organisations, and we really encourage across LHN collaboration. And we think that that's one of the motivations behind this scheme, and we really look forward to seeing across LHN projects come to life. You see a lot of projects that are within LHNs and that therefore aren't considering the ability to scale or taking in those considerations of context to the same level. So answer to that question is absolutely yes. Beck's got the hardest job in this. Another question. Can this be used for pilot work that will lead to a large project for MRFF funding? The answer is yes, and that's exactly what it's designed to do. If you need to do something that will lead to a large project that will, be well positioned for MRFF funding, I really encourage you to think about getting involved in this grant and putting in for something that will really detail, really help you jump ahead in your MRFF application. So the answer to that is yes. Well, she's getting there. She's writing. Thank you. Okay, the next one. Getting some questions. Oh, is that a question here?
No.
Oh, I say we are getting some questions that we'll have to take on notice. So we won't be able to go through all of them now, but definitely we will take those on notice. Do you want me to read some of those out or? Okay. Can you please outline the IP requirements that will be requested in this scheme? We'll take that one on notice and we look forward to coming up with a good answer for that one. And as I said at the start of the presentation, this is new territory, so some of these things won't be perfect, but we certainly will be taking advice from the people that really have a lot of expertise in these sort of grant rounds, and we'll let you know on the IP. That's a good one to put onto our list of keep working on. Can a researcher be on more than one project as long as they're not project lead? And the answer is absolutely yes. We want people to think about how they collaborate across organisations, and obviously researchers would be pivotal, especially some of the expertise that researchers are bringing to the table. We really recognise the importance of the researcher expertise in being able to wrap around health services, and some people may have specialist expertise which is valuable in more than one health service. Another one. Will interstate collaborations be encouraged and ranked higher than those within South Australia? It's a good question. They won't be ranked higher. They'll be taken into consideration. If you are just within the boundaries of South Australia, depending on the project, we'll have to see how it unfolds. But certainly the message you get from the MRFF is they want people to be thinking about how you scale up nationally. So if you're in a position that you can bring in people from other states or people that are supportive of your grant, that are bigger than just South Australia, we'd encourage it. And that's straight from the MRFF. So in terms of ranking higher, we'll wait to see how the review panel works with that. But at this stage, so being non-committal in that space right now, but just to encourage people to think about future scale up. Following on from the LHN collaboration question, would two colleagues in the same university be seen as different colleges? Different from the same university. So two colleges in the same university be seen as different academic networks? No, they wouldn't. We actually want people to reach across academic institutions. So you might see think we're splitting hairs there, but we actually know that there are numerous seed funding schemes within academic institutions, and we encourage you to actually look outside the boundaries of your academic institution. Now, I think, how are we going with time here? 12:40. So look, I think what we might do now is say that we do have a few other questions coming through. So instead of trying to answer them now, I think some of them will be referred to in the frequently asked questions that we'll now work on and have ready by Friday. Is there any others that I should? I think most of them are quite specific, and so therefore having general, is there a track record of the lead research scored? No, I think we're better off at this point. That, as I said, they're quite specific applications, specific questions, and probably we're better off answering those through the Q&A process, which we will now put in place. But I'd just like to say, look, it's been a great opportunity to work with a whole lot of people to get this up and running. We see it as something that can really position South Australia in an advantageous position. I happened to be in a meeting last week that Marsha Somi and her 2IC Rachel were at, and that they were actually quite interested in the scheme and interested in how we were going to pull it off and what benefits it would have for South Australia. So I think the MRFF are interested in projects and processes that can really encourage people to put in quality applications for the MRFF. We know that Victoria has a huge share of the pie, and we'd love to change that. So with those comments, I'd just like to say thank you very much, everyone, for attending, and we look forward to receiving applications. If you have any further inquiries, don't hesitate but to use Health Translation SA's inquiries email address, and certainly you can contact me direct as well. So thank you for attending, and we look forward to working with you over the next months and years. Thank you.